I hope my patients, when they leave, that they say, that doctor really listened to me and seemed to care. Playing sports, growing up, I had a few injuries myself. I had a couple of fractures. The ankle injury was actually in college, so I was in a cast and maneuvering around campus on crutches. I remember those times, and I try to have empathy for my patients who have those injuries. Orthopedic, especially as a Spartanburg, was a good fit for me. I like the size of the group. I like the cohesiveness of the group. Being able to work under the same roof with your partners and being able to bounce ideas off them and have discussions about your patients with them, why you're seeing your patient. That's a nice way to practice orthopedics. I grew up in Georgetown, South Carolina. I went to Duke University for my undergraduate degree and medical school at the Medical University of South Carolina in Charleston. And then I obtained orthopedic surgery residency in Greenville, South Carolina. And then I did an additional year of training in sports medicine at University of Virginia in Charlottesville. And then I was in private practice at Coastal Orthopedics in Conway, South Carolina for about 10 years. And then most recently, for the last 4.5 years, I've been with Greenville Health System with Stedman Hawkins. We have 2 twin boys. They've completely changed our lives. We take the boys to the park all the time. They love to swing and enjoy this upstate weather. When we see a new patient, we usually get a thorough history of what's been going on, how their problem is affecting them, what they've done to try to help themselves. The fix is not always terrible. It's not like we're always delivering bad news. Sometimes it's just a change in an activity regimen. I think the best part of orthopedics is usually the last visit. That's the visit where the patient's fracture's healed, or it's the last visit from their surgery that they've recovered from. It's the end result, it's where we've got them to. If you have an orthopedic issue, it would be a privilege to take care of you and get you back on the road to recovery.